Hey, I'm Dr. Sebastian with Performance Play Sports Care, and this time we're going to go over actually an ultrasound. We have a person that came in with a knee condition who agreed to let us use his knee as just kind of troubleshooting. We're going to do some orthopedics tests. We'll look at the ultrasound, give him basically what his diagnosis is and is not, and give him some suggestions of how he can work with this on his own. So I really love doing ultrasound. I think it's really, really helpful. As you can see, this is much less invasive than doing something like an MRI, where we can get pretty much the same information and we can get a really good game plan of how to manage these cases. So we're going to start with the knee right now. You'll see the screen and we'll pan back and forth, do a little bit of technique. Keep in mind this isn't really for sonographers, so if I'm using different terminology and if you are a sonographer, I'm trying to make this for general public. That's why we're keeping it a little bit lower on the terminology. So I hope this helps. All right, so to start out with ultrasound of the knee, we're just going to go and lube this thing up real nice. And the cool thing with ultrasounding knees is you can kind of figure out like what it is and what it's not. And it's the diagnosis isn't always the most important thing, but sometimes it's important to know what the diagnosis is not, so you can assess what your risk reward is and so on. So the first thing you want to check out here is actually, Logan, why don't you tell us what the knee feels like?
So if I bend the knee, if I pick it up or I reach it out, like I'm going to take a step or go up or down a stair, I just get a super sharp shooting pain through the outside of it.
Through the outside part, so just out here, right?
Yeah, exactly. Okay.
So I like to start the exam with just kind of seeing, I want to see all the aspects of the knee. I don't want to just go just here. But what I usually look for first here, if we're looking at the screen, so on the left side of the screen here, here's the quad tendon coming down, and then it inserts into the patella right here. On the outer skirts of it, as I'm kind of panning back and forth, on the outer part, you see this black area come up. The black area is fluid. This is the superior lateral recess of the knee. And what I'm kind of looking for is on this, and I know it probably looks like a bunch of snow on the screen, but I'm mainly looking for areas of white where there shouldn't be white and areas of black where there shouldn't be black. And if this is a really new injury like he says it is, then we're looking for something that is overwhelmingly probably black. And we will check. I see there's something up here. This looks more of kind of like a small enthesophyte or like calcification hardening of the quad tendon, but again, pain is not there, so I think it's an incidental finding. On the outer part of the knee here, I see that, again, there's fluid within the superior lateral recess of the knee. And I'll find a picture and I'll put it up on this video as well, see what I'm talking about. But this is kind of like where the knee balloons out. This is one area where it likes to go. And it's going to feel like you want to stretch it, but really there's nothing to stretch. It's just fluid under the cap, but it's continuous with the rest of the knee. And when it's really, really inflated, I've seen it go all the way up here before, and I've seen it mainly with like ACL injuries, sometimes meniscus. But so if he's got something really aggravating him, I would actually expect to see much more in here, more fluid, if it was going to be a meniscus injury, an ACL injury, something of that nature, something that could be continuous with the inside part of the capsule. So that's the first thing. Second thing, you can take a peek through the window in the front side of the knee. Here's the patellar tendon on the left side here, or sorry, the patellar tendon here. Here's the inferior pole, or the bottom part of the patella. Put that thing up and make sure you can go from up here. I just want to make sure we got a good view. Okay, cool. So going down, this is where the kneecap where the patellar tendon attaches down here. He's got a weird shaped knee, so it's kind of hard to see, but it looks like a little freeway here. This looks normal to me. It's normal size, up and down. We can actually measure it if we wanted to, but stuff like this, but we really don't need to. So, also looking down here as well, we can take a peek and see if there's a lot of edema or fluid within Hoffa's fat pad, which is an area where some people have an issue where there's a lot of vascularity at. I don't see any major issues here. And we put a Doppler on it too, which a Doppler shows, it shows velocity of fluid or movement, and I don't see any major vessels coming through here. and I don't see any major vessels in the tendon either, which would be shown with like patellar tendonitis or tendinosis rather, and so on. Okay, usually we'll check in cross-sectional area too, but I know the video is not for sonographers, so we're not going to go too much into detail with that. We just want to see what his major issue is. On the inside part of the knee here, we can really take a peek at the medial meniscus, which is a really commonly injured part on people. On the screen here, you're going to see here's his femur, or femoral condyle. Here's his tibia. This V-shaped thing here is the meniscus. And the reason why I don't think this is a major issue creating his issue is, number one, it's on the wrong side. But second is I don't see it ballooning out. And I'll see if I can find a picture and put on a video as well to show like a really irritated meniscus. And if you saw one, you'd say, wow, this one looks pretty normal. So I'm going to pan all the way around the joint line here. Looks pretty good. There's a little bit of a possible cyst formation here, or like a small old tear, but again, I don't see a lot of overspill and block on the side, so it doesn't look like a big deal. Okay, so looking at the outer side here, now this is where he's got his issues, so we're going to pay a little bit more close attention, but already I think what we've ruled out is fresh ACL tear, medial meniscus, fresh tear. It looks like there's a little bit of an old something there. And now we can tell we're on the outer part because this is the popliteal groove. The popliteal tenon goes through it. And a lot of times when there's been pain or issues with the outer meniscus or lateral meniscus, this whole divot here will be haloed in black, and I don't see a major issue there. There's a little bit of fluid there. You see it on the left side here. And so you've had ACL injuries before, you said, right?
No, it was meniscus both times.
Oh, meniscus, okay. I thought he had an ACL injury, which I was going to say there's not a lot of issues with bone spurs in here, which usually you'd find after an ACL injury, after a few years. So we're looking at the lateral meniscus here, okay? Looking to see if it's not ballooning out, like I said before. And we can tell we're on the lateral meniscus because there is an artery right there. See that pulsating one? That's the lateral genicular artery. Anyways, so now we've figured out that here's what we've possibly ruled out. So lateral meniscus, medial meniscus. We should check probably for a Baker cyst on the back side just to make sure. The reason why I'm checking all these recesses is to see if there's a possibility of an injury to the passive components of the knee, which then would be a reason to possibly stabilize the knee. So he might go in a brace. So we figured out that, we still got there. So now we're going to do some testing as well. So I'm going to test his inner part here by pressing through, and that feels okay?
Yeah, the only thing is just the pressure of your hand on the outside, actually.
Okay,
On the inside.
so to make sure that the pressure is not a big issue, now I'm going to cut my hand. Does that go away?
Mm-hmm.
Okay, so now it's just the pressure. It's a negative test, so his medial components in the knee are intact. So I'm pushing through this way now. How does that feel?
Fine.
Okay, so now we've confirmed that the lateral components, the lateral collateral ligament or the ACL, as well as the lateral meniscus, seem pretty good. How does that feel?
Pretty good.
Okay, so let's see, don't roll over my mic here. Making sure the ACL is intact. And just to confirm any meniscus parts, there's lateral joint line tenderness is a good test to try. Does that bother you?
Not there. You crossed over it on the way up to there, so it's lower.
A little lower. Okay, so I'm in the lateral joint line here. In case you guys want to follow along at home, there's a divot here. It feels like a goalie. It runs this way. Still nothing?
There.
Okay, so now we're up a little bit higher. So here's the lateral joint line again, going a little bit higher here. Nothing?
It's a little, just a little.
Okay, so now we're looking at the possibility of having like an IT band syndrome. It's funny, the IT band, you usually don't see it too visibly on ultrasound because it's so thin, and there's actually a bursa up here which you can have inflamed. But this is the lateral femoral condyle. And IT band is known as like a friction syndrome. This IT band can come, I'll show you from the top. This is the IT band right here. And it's funny how you can see the femur right there, how much it is. Actually, sorry, it's not the femur. There we go. So look at how much of the picture is actually the IT band. It's hardly any of it. So to see it visible and thickened is a little odd sometimes. So we're going to trace this down and see if we can hover right over the spot where he's having his pain. So there's the bone on there's the lateral femoral condyle right there. Let's try a Doppler. See if we can get any vascularity that would indicate any possible tearing, or sometimes it indicates that there's a fresh injury. So now we found a Doppler finding. Let's see if I can get a picture of it. And there's the IT band up there. There's our vessel. Okay, so now I'm going to slide my finger in. You'll probably be able to see it on the left side of the screen right now. So now I'm going to come into right around here is where we found that finding. Is this where your pain is then? Okay, so here's the reason why ultrasound would be helpful for this type of knee condition anyways. So we've ruled out internal knee pathology, ACL, PCL, medial meniscus, lateral meniscus, LCL, MCL, and now we've gone over the portion where he's actually painful, found positive Doppler findings or vessel findings, or what we call angiogenesis right here. It's pretty positive. And the great thing with Doppler is a lot of times it will almost just point you right to the pathology. And now we have thickness about the IT band, which is right. Let's see if I can measure this, or I'll take a small shot. Get a nice clean IT band shot. So right here, we're looking at the IT band right there. So there's also over here too, this is a positive finding or adenomous black finding, so it's very, very suspicious of having an injury as well. So the way I'd probably take this, oops, I don't want to save this exam. Anyways, the way I would probably take this is we have to make sure that he doesn't have any internal femoral rotation when he's walking, landing, running, whatever he's actually doing, because it'll shift this, it'll shift the femur and the contact point slightly more towards the femoral condyle or the lateral femoral condyle, and it'll create this friction to happen. There's a lot of research to show that hip and trunk is really, really correlated to IT band issues, and I think they did some studies way back in the day where they basically just strengthened the heck out of the lateral hip here, and I want to say 90% of the cases actually went away at the knee. Anything to add? Okay. Cool. So if you guys want to, I'll let you take the picture. If you guys want to get an ultrasound, you can definitely contact me, so Dr. Sebastian at Performance Place. And if you have stuff you want me to talk about on podcast or on videos like this, just let me know, and you can go to our website. That's p2sportscare.com. There is a voicemail button. You can leave all your questions right there, and the more detailed you are, the more detailed you are with your question, the more likely I am to answer or answer it on video. All right, thanks a lot.